But you can always do
Cheese,
that
Langston.
What?
I'm saying cheese for the camera.
Oh.
You don't these be out of them.
Okay. Imagine someone collapsing in front of you. Their heart stops and they stop responding. Would you know what to do? Knowing how to perform CPR, short for cardiopulmonary resuscitation, can make the difference between life and death in an emergency like this. Cardiac arrest can happen anywhere at any time. Knowing how to perform CPR correctly could help save a family member, a friend, or even a stranger. Today, I'll demonstrate to you how to check the scene and the person, how to perform chest compressions, and how to give rescue breaths until help arrives. Let's begin with how to check the scene and the person. First, you always want to check the scene around you and make sure that it is safe for you and the victim. Next, you want to check the responsiveness of the person by tapping on their shoulders while shouting, "Are you okay?" Do this no more than 2 times. If they do not respond, immediately call 911 and have someone that's near you go retrieve an AED if one is available. Then you need to check for a pulse while simultaneously checking for breathing for at least 10 seconds, but no longer than 10 seconds. If you cannot feel a pulse, you need to start compressions immediately. Now that you know how to check the scene and the person, let me explain how to do chest compressions. First, place the heel of your hand in the middle of the person's chest, near the lower part of the sternum. Then place the other hand on top of that hand, interlacing fingers. You want to keep your elbows straight while your shoulders are directly above your hands. This is easier for you if you are on the side of the person. Then push down hard and fast, at least 2 inches deep, and at the rate of 100 to 120 compressions per minute. The beat to the song "Staying Alive" is often referred to as how fast you want your compressions to be. Make sure you're allowing the chest to completely recoil in between compressions. Now that you know how to give chest compressions, let me explain how to give rescue breaths until help returns. After giving 30 compressions, you want to deliver 2 breaths. First, you want to open the airway by doing the head tilt and chin lift. If you do not have a pocket mask, you need to pinch the person's nose, make a seal over the person's mouth with your mouth, and give 2 deep breaths. Each breath you want to be 1 second long. While you're giving these breaths, you want to see the chest rise. If you do not see the chest rise, readjust the person's head and try again. Continue this cycle of 30 compressions and 2 breaths until either help arrives or an AED arrives. In closing, I leave you with this. Knowing how to perform CPR can be the difference between life and death in an emergency. Today, I demonstrated how to check the person and the scene, how to give chest compressions, and how to give rescue breaths until help arrives. A little knowledge can mean the difference between life and death. Be the person who knows what to do when it matters most. Thank you.